All right. We do have a forum for Trevor County. So for the record, I will announce that today's date is August 19th. Pretty bad, I look at my cell phone, but I don't know. So today's date is August 19th, 2021. The time is now 6 p.m. We are in Trevor County Commission Report. We do have a forum. And I do know that there are some schools out there and districts that have forums, and I'll let you announce that when you guys come up with the program. But just for the record, if the forum's president, you have to announce it. I'm usually the biggest violator of my own rules. I'm going to try to keep this to like 5 minutes per person. If you guys need more time, just stay. I'm not a sucker for goals. Everybody knows that. So if it's important, then just talk about it. Take as much time as you need. But I'll try to breeze through my point because it's important to have it. So it's not about county judge. It's about you guys. So I want to thank you all for being here. This means a lot to me, and especially during this time. We're seeing a huge surge in patients right now in our hospitals, and I think our children getting back to school. To have all these school districts in one spot at one time, I don't know if we've ever done that before, and it's the most important thing that we could possibly be doing for the safety of our children. So thank you all very, very much, all of you all for being here. It means a lot to us. I'm going to give you just a real brief background. We're about a year and a half into this. About a year and a half into this, we've stopped at nothing. We've had great teamwork between the city, Spawn Hospital, the volunteers, our nurses, our volunteer nurses from Union Corpus Christi, from a Coastal Bend College. I could go on and on with all the volunteers that have been helping. We were credited a couple of weeks ago, our state representative, James Ozone, and they looked per capita in the state of Texas. We led it, and we continue to lead the fight against COVID-19. And not only the vaccines, but before vaccines were even invented, we were the first outdoor that created a regional testing facility right here in Everett County, and we opened our doors to everyone. And I'm going to tell you, about a month ago, before this new spike, we still had at our Everett County Airport, we still had folks flying in from everywhere, out of state, out of country, just to get back to the Everett County because they knew that we had an endless supply. And we never closed our doors to anyone. And that's something we need to be very, very proud of Everett County because we did the way in the state of Texas. And it wasn't me, it was everyone I just talked about. So let's give a round of applause to all our volunteers who really make it happen. Yeah, when I talk to volunteers, I got one particular group that I want to talk about here a little bit because we, you know, it's been a very, very, very busy year, and COVID has always been the first on our agenda. We had to kind of gather our priorities. Like we were supposed to build the JK Northway a year ago. We were supposed to do all these things, and we turned our JK Northway into a regional management center so that we could help everyone. We just really went above and beyond, and the folks that have still been there and have never left. You know, we've got Ben Gonzalez, and we've got Art, our nurse at the vaccine clinic. We've got David Garcia and the Human Services team who never stops. And not only in Everett County and the surrounding area, not only can you get a vaccine or a test at any time, but if you call us and say, hey, listen, I don't have a ride to your facility, we'll come to you regardless. If you're in Everett County or the surrounding area, if you want a test, if you want a vaccine, David Garcia has his van, he's going to pick up Ben and Art. They're going to come to you, so there's no excuse not to have it if you want it there. And that is like in my mind as a retired business man, that's going above and beyond what I do each and every day. So thank you guys very, very much. As we're all aware, the Supreme Court has basically made it taken away the authority for county judges and for mayors to issue mask mandates. Okay. That's just the way it is. That's the facts right now. It may change some days. I personally hope it changes. I'm not here tonight. It's not a venue where we're gonna dispute rules, but yet we're gonna come together as the chosen leaders for this community, and we're gonna discuss how we work around the rules to ensure the safety of our students each and every day. With that said, the purpose of this meeting was to bring the highest educated folks in the community, which is our superintendents, our school board members, bring you guys together, share your ideas, tell us what you're doing. As emergency manager, I wanted to know exactly what your safety plan was going forward, and more importantly, I wanted you to know that at the end of the day, Everett County is here to offer any and every resource that we have to make sure that you're successful following through with your safety plans, and we'll endorse whatever you push forward. We're going to support whatever you push forward. We work for you. We work for you, and our commissioners, our amazing staff. Let me tell you, our commissioners, we get it. We know that we know what's out there. We know that there's tough decisions to be made, and we've all agreed that hey, whatever you leaders choose for your individual school, we're going to support you. Whether they shoot it down or not, we're going to support you. There's just certain areas that we can't endorse, myself and the mayor as the county judge and as mayor. There's certain legalities that prohibit us from actually signing a document, because then it becomes illegal according to the Supreme Court. But you know what? If I got a superintendent out there, a school board that says, hey, look, this is what we're going to do for our school district, well, who am I to shoot that down? I'm going to support you guys 100%. So just know that right here. At the end of this tonight's meeting, I want the public to be involved. So at the end of tonight's meeting, if you can get with Francis, please, each individual school district, give her a good email contact, because I know there's going to be a lot of folks out there that have questions, especially pertaining to whatever district their kids in. So to get Francis the email, and that way we can post it for Janine Reyes. She had, Janine Mamazio, so our prayers go out to her. So Janine had to fly out today, but she said, send me the email addresses. She said, I'll post them on the city's website, we'll post them on the county's website, so that any parents out there or any citizens that have questions they can send them to us. We'll get them answered and we'll post them publicly so that everybody can read them. Real quick again, because I'm running out of my plugins. Message for our parents. Okay. Message to our parents from the county judge. Here's the deal. I just said that the county judge and the mayor can't enforce you to. We can't set mandates to enforce your children to wear masks at school. But a parent can. A parent can enforce a mandate. Okay. If my mother says that, hey, I want Rudy Madrid to wear a mask each and every day at school for every period, then that's going to happen. So I asked every school out there in Frederick County. Oh, and by the way, I keep saying Frederick County, but where's Bishop? Can Bishop raise your hand? I know Bishop is down here. They might be on the way. We included Bishop on this because we have a lot of children in Bishop as well. So I'm asking that every school district put a permission slip out there, send it home to all the parents. So that if there's any parent that says, hey, listen, I want my child to wear masks, well, then enforce that because that's the parents' wishes. Call it a parental mandate, call it a parental order, or just call it because I said so. And what I mean when I say because I said so, I remember like being a high school, senior HET high school, and it's a Friday night. I'm saying, Mom, can I borrow the car keys? And I'm sitting there. She's like, sure, Mijo, but I want you in the doors by 10 p.m. And I said, well, wait a minute. Like all my friends, they get to stay up till midnight. I said, why do they get to? And I go, because I said so. So tell your parents, because I said so. If they tell you, hey, I want my child to wear a mask, make them wear it, okay? For those parents that choose, they do not want their child to wear a mask, I get it, and we're going to respect that. We're not here to get into an argument with anyone. All we're going to say is this, please, please educate your children and they choose not to wear a mask. Educate them on social distancing, on hand sanitizing between every class, on washing your hands, let our teachers know that, hey, listen, I don't want him to wear a mask, but we're going to take a little extra care of him or her while they're in our school to make sure that they don't harm themselves or anyone else around them. Because at the same time, you got to think of everyone around these children, and you've got, it's funny, on the way over here, I thought to myself, I thought about school teachers, I thought about our administrators, our principals, our custodians, our maintenance folks, our cafeteria workers. I thought about all these hardworking individuals. And then I thought about Princess Bond Hospital. I thought about the nurses, and I thought about the doctors. And I thought to myself, they're all on the same playing field, just different working environments. Because in the school, these school workers are putting their life on the line each and every day for one common goal, and that's to ensure the absolute best quality education for the children. And they're willing to die for it. They're coming to school to do it. They're still coming. So we've got to think about them. They've got families, they've got loved ones, they've got children, and so this is about everyone, about keeping everyone safe. Because at the end of the day, the only way we can beat this is if we work together on this. And I want to say it again. At the end of the day, the only way we can beat this is if we work together. I served in the Navy for 21 years in healthcare. And I'm going to tell you, I've been around the worst of the worst. H1N1, SARS, tuberculosis, pneumonia, anthrax, Ebola. You know what? We didn't have it like that out there. But you know what I did have? I had a mask with me. And I'm going to tell you, between God and this mask, I never got to lose one of those diseases. Okay? So I'm not trying to challenge anybody who puts their little tweeters, the little Snapchats, the little shots, the little videos online. I'm not trying to do that. I'm just going to tell you what a really good perspective was. It worked for me. And I think it will work for our children. We beat it once, the numbers are down, we beat it once. I'm going to let Rick O'Neill here in a minute talk to us about some of the local statistics that'll help you show. I don't care what's going on in the world, I do care. But tonight's meeting is about Frederick County. So I'm going to show you what our statistics are. Aside from what all these other experts are saying, I'm going to show you what is happening in Frederick County when it comes to vaccinated versus unvaccinated folks, okay? And I'll let you draw your own conclusion from it. I'm not going to sway you in any direction from that. Before I let Rick O'Neill talk, I did come bearing gifts today. I did come bearing gifts. So right now, as we speak, and I gotta give some kudos to my man, Ray and his team. They really worked their butts off. Because we didn't have a loading dock, so these guys didn't handle it. We had 3 18-wheelers that drove into our JK Northway, and full to the rim with PPE. I'm talking masks, hand sanitizers, disinfectants, gloves, face shields. It's all yours. We've got 3 18-wheelers all for you guys. We're gonna get you on Ray Delegaz's phone number. Have a representative from each school district tonight. Get his phone number, call Ray. He's at your beck and call all week. Tell your guys to come with a flatbed trailer. He's gonna have a forklift and load you guys up with everything you need. And when it's all done with, guess what? Call Trevor County and we're gonna get you some more of it. You'll never be without supplies from this point forward. Okay? We've got another big, and this one was just announced. So we went to bat with them, and we're so lucky to have Gary Barney from the Texas Division of Emergency Management Services. I'm at the end of the table here. I'm gonna tell you that. So there's a couple of things that are going on in Turkey County. One, like a lot of counties around us, we have a nursing shortage because of the surge in patients. Okay? So I went to bat for Spawn Christus, and not only for Pepper County, but Alice, Beeville, Corpus Christi, all the strong Spawn hospitals. Because of that, and they just started, I think, Rick, they just started boots on ground this week. We've got nurses here, we've got respiratory therapists here, and there's more on the way. We asked for it to come, and it's all because of the Texas Division of Emergency Management that decided to listen to us, and they've always been there since day one. So thank you again. Got another one. We went to that and we advocated for the region. Remember, our JK Northway Center is a regional emergency operations center now by disaster. It's a multi-faceted complex entertainment center that's going to house our rodeos, our livestock shows, all that great stuff, our church festivals during the day. But just like the FEMA dome, when a disaster comes, we've got to utilize it for disaster. Okay. Because of that, it gives us a lot of pull when we request things. Although we're literally about to start rebuilding the JK Northway. So I went to the governor's office and I asked them if we could have a regional infusion center, a Regeneron infusion center. Now let me tell you about this Regeneron infusion center if you don't know about it. Go home, Google it, and learn about this. This is the next latest and greatest. This is saving lives. About 90% of patients that contract COVID who go to the hospital within 10 days of contracting COVID and they're symptomatic, we can send them to a Regeneron infusion center, and there's a 90% chance that they will not end up in a hospital. In Fairburn County, Fairburn and Swan Hospital was so instrumental that they said, hey, we know the judge is bringing this here, we're bringing a regional infusion center, but we're going to start doing it ourselves here in the hospital, and it's very, there's a lot of work that goes into it, there's isolation that goes into it, so it's hard for a hospital to do it, but Chris's hospital bent over backwards to do it anyway, and they've already done over 70 of them. And I'm going to tell you, out of over 70 patients that acquired COVID-19, only 1 patient became hospitalized, and that's because they had underlying immunocompromised. So I've got to tell you, Spawn Hospital really kicked butt, and this stuff here is great. I did have confirmation today by the Texas Division of Emergency Management. I do have confirmation. We've got the infusion center, so it's coming. I chose to have it centrally located at the Richard Borcher Coliseum. I did that for one reason, because we're looking at the entire coastal band, Corpus Christi and Kingsville, but I wanted to make one message very, very clear to the state of Texas was, listen, we're endorsing this, we're bringing it here, but we're not going to get end of the line treatment. If any of in Oasis County, if anybody else wants it, it's open to everyone. Barbara can also endorse it as well. But at the end of the day, Fairburn County patients will be seen when we request it. They better be at the head of the line as well, just like everybody else. And I'm going to make sure that that happens. Okay. Lastly, I'm kind of like, and I apologize to Sheriff, Sheriff and I see eye to eye on a lot of things, and I got to put out kudos to our sheriff, Mr. Patrick. He's an amazing individual, and he's been my right hand partner since day one, along with Chuck Schultz and Commissioner Schultz and all my commissioners for that matter. But I got to tell you, so Richards, he's one of those savvy guys who's all about the latest and greatest technology. You know, he's all about that. And you know, Richard, that's where he lives and breathes. I had an amazing privilege of going out to San Antonio this week, and I met with a real neat group of folks. And there's a system out there. We call it new to the United States, but it's actually one on in Europe, and it's EPA approved. I was mesmerized when I saw the presentation they gave me, and it's called. I had to write it down because I keep messing up the name every time I talk about it. But it's called the Aqueous Ozone Water Disinfectant System. That's a system that is top of the line water filtration system that can disinfect. And we're going to have like a real quick 5-minute presentation by the representative. They're here, right, Francis? Yes, they're here. So we're going to have them give a real quick 5-minute scenario on this, and then we're going to set up a workshop with these folks and every maintenance director for every school in Tucker County and Bishop, because in Tucker County commissioners, thank you guys very much. When I brought this to their attention on Monday, we're going to buy one of these systems for every single school in the district, including Bishop and all their schools, and we're going to put the bill for it. Tucker County's going to put the bill for it. So that's going to be an amazing thing. I read to the one I was talking, so y'all don't have any time to talk. With that said, Rick, if you can come up here, say a couple words, and then I'm going to bring our obvious folks up here so they can talk about the product for free. And then I'm going to turn it over to the schools, and this meeting's about you all, about sharing ideas, sharing innovations, and it's about, hey, knowing, understanding that Tucker County's here, whatever you need, whenever you need it. We're a phone call away. We're not going to stop until we get rid of this corporate pandemic. So, Rick, come on up.
Thank you, Judge. As Judge McPherson said, my name is Rick Wooding. I am president here at Christian Swan Hospital, Clayburgh, and also Christian Swan Hospital, Alice. The judge has an extensive healthcare background, as I do, also being a registered nurse for 27 years. And I spent most of my time in the surgical department. Every day in the surgical department, you get to wear a mask. And why do you wear a mask? It's to prevent the spread of infection. So a couple of things I wanted to mention. As y'all may have seen in the social media and the news, hospitalizations for COVID positive patients are on the rise. The need for critical care beds is also on the rise. The need for ventilators on the rise. When we look at our emergency departments right now, really throughout the whole state of Texas, you see a lot of challenges that are going on. Not only are emergency departments taking care of COVID positive patients, but they still have to take care of patients that are coming in with strokes, heart attacks, diabetic ketoacidosis, trauma, motor vehicle accidents, you name it, they still have to cover those patients, and we're happy to do it. As a hospital and as a ministry with Christian Swan, what we're seeing is the vast majority of our patients that are being hospitalized with COVID-19 are those that are unvaccinated. What I would do and ask of each one of you is to please encourage vaccination, both in your home, with your family, with your loved ones. I know that when folks are vaccinated, they feel that not wearing a mask is necessary. But what we have to realize is even though you're vaccinated, you can still contract COVID-19. Maybe you will have symptoms, maybe you'll have minimal symptoms, but the worst part is you can spread that to others that are unvaccinated, or even those that are vaccinated. Another thing that I would ask you to do is please make sure you're wearing the face mask, wearing it properly over your nose and over your mouth. We wear the N95 at work. Also practice social distancing. And one of the main things that we can do to prevent the spread of infection is good hand washing and good hand hygiene. Now, I am a deacon at St. Gertrude's Catholic Church, and it's a great honor and service to be there. And if it's okay with the judge and everyone else, I'd like us to say a short prayer for all our healthcare providers. And if you wouldn't mind, raising your right hand. Blessed are you, Lord God of mercy, who through your Son gave us a marvelous example of charity and the great commandment of love for one another. Send down your blessings on these, your servants, who so generously devote themselves to helping others, those at the bedside, those in our school systems, those that work for our government. And when they are called on in times of need, let them faithfully serve you in their name. We ask this through Christ our Lord. Amen. Father, amen. The last thing that I want to say is being Catholic. There's 5 beautiful, wonderful words that I want to talk to you about that are in the Bible. There's many wonderful words, but these 5 words we need to remember as times are tough and there's challenges in the world. And it came to pass. As the judge said, together, our faith, our collegiality, our friendship, our love for one another will help us get through this. And we will get through it, but it's going to take all of us together, united. Thank you very much.
Okay, at this time, the office Ozone water disinfection process, you can just give a real quick synopsis to our school leaders here, let them know what they got up to.
Where do you want me to be?
Anywhere you want, partner.
Come in a little closer, is that all right?
Yeah, sure.
All right.
We need to do it with microphone. Someone else, Francis?
Can y'all hear me okay?
Yeah.
Okay, so thank you. My name is Darren Simmons from the Parental North America. We're a company that was founded in late 2019 to commercialize technology commercialized here in the U.S. It's a technology that enables the development of production of disinfection sanitizer on top of the growth. Disinfectant is ozone is the vector. So it produces ozone, and you guys have heard of ozone probably a lot of different ways. Which you may not know that ozone is one of the most powerful disinfectants that's available to us. More powerful than oxidant and chlorine, alcohol sanitizers, sodium hydroxide, a lot of familiar compounds and chemicals that you're familiar with heard of. It's powerful, but we don't use it readily every day because it cannot be produced and packaged and distributed because it has a very short half-life. So it requires a product or a technology that can produce it on site and you're ready to use it. That's what our technology is able to do. So ozone is a molecule of oxygen that's highly reactive, kills bacteria on contact, it activates viruses on contact. Some are a little harder than others, but it's faster than chlorine. In fact, it's 50 times more powerful than chlorine. As an oxidant, it works 3,000 times faster. So with the short half-life, or its willingness to decompose in a really quick manner, we have to have a technology that can produce it. And we also have to have a source of oxygen. So if you're familiar with it at all, historically, most of the technologies today produce ozone from the air that we breathe and surround us. And that air is 78% nitrogen. So unfortunately, when that ozone is generated, it produces a lot of byproducts like oxide, etc., phenol, mercury, they're coming in contact with. It's also in a gaseous form, which can become near to 10 times the concentration. So our technology it sources the oxygen from water. So water is H2O, the molecule is H2O. Our technology will split it, isolate the oxygen atom, and then combine it into ozone. It then also leaves it in water to an aqueous solution, which leaves it very stable, pH neutral, but highly effective at killing bacteria, inactivating viruses, It'll destroy fungus, mold, yeast, etc. So this unit, which I believe is the first sample of the units that we'll be installing and using, is what we call an inline water disinfection system. So you plumb it to a water supply, it's a water source, tap water source, just like you would find in a sink or for a laundry, or a washing machine, or another water source, a power supply, and then it will dispense the concentration of aqueous ozone that's at a level that's high enough to kill more than 99.9% of bacteria in contact. It doesn't discriminate on the bacteria that are killed. Bacteria do not become resistant to it, so it's not effective against things like staph, MRSA, gentleman before me, that's the antibiotic resistant bacteria that's found in healthcare settings. E. coli, salmonella, listeria, etc. This is one product we have others for different applications, but this is the one that gives you the ability to produce on-site at various points of use. You can either use it to treat certain environments, or you can actually dispense it into containers to be used as an application for countertops, floors, restrooms, fruits, vegetables, food. So very safe, very natural. Our bodies are naturally resistant to it, so they won't react or get irritated about it. It does a pretty good job of disinfecting and sanitizing. So, about another 5 minutes.
School desk.
School desk. School desk, just about any kind of surface or environment that you want to disinfect. We're asked to keep it under 5 minutes, but we'll be around afterwards. So if you have any questions, please feel free to talk to us.
Thank you very much. Next one, before school starts, city manager, Mark. Oh, yeah. Let's skip it.
Good evening, everybody. My name is Mark McLaughlin. I'm the city manager here for Kingsville, Texas. And on behalf of Mayor Santee, he couldn't make it tonight, but he wanted to express his sincere appreciation to the judge for pulling this together and for all of you to come to figure out this problem we got ahead of us. I'm joined by 3 of our city commissioners, Commissioner Lopez, Commissioner Alvarez, and Commissioner Torres, 3 of them far left there. So we're well represented by the leadership of the city tonight. And what the mayor wanted me to pass, and we talk about this pretty much every single day, is what can the city do to keep the services running and not have to shut down? Remember that I have about 265 employees that are full-time that are keeping the wastewater treatment plants running, keeping the water wells running the garbage trucks, police, fire, utility billing, taking your payments. We're one deep in many of those functions. Anybody that goes down sick, it's a lessening of our capability. So we have always said, from the very beginning of this pandemic last March a year ago, that we're going to follow the CDC guidelines. I can tell you that I was, my personal opinion is that the mask mandates not being allowed to order one of those. I have an opinion on that, but I will also express to the mayor, and I believe in this fully, that we don't necessarily need a mandate to do the right thing. So we have asked the city employees and anybody that visits a city building, if you're going to come in, we ask that you wear a mask. I can't mandate it, but I think it's the right thing to do. Because a lot of people, I think, are misinformed that if you get the shot, you're 100% protected and that's all you need. Or if I wear the mask, I'm 100% protected, that's all I need. Nothing could be further from the truth. Everything that we do, from social distancing, to sanitizing, to masks, to get the vaccine, are layers of protection that provide you a better chance of not getting COVID and ending up in the hospital. And we can tell, I've heard the folks before, but I know the judge had a discussion with Lacey today from the hospital, and our hospital's full, folks. In fact, it's over full. And I have 2 medic units that are doing about 90 calls a week just on ambulance calls. And the majority of those are probably COVID related. So my ambulance guys have a hard time figuring out where to take them. There's no room at the inn. You can help us, and this is for everybody that's listening out there. If you make a 911 call to the dispatch, my dispatchers would really appreciate it if they knew what my firefighters are walking into. COVID positive, or yes, somebody in the house, please tell the dispatcher. They will relay that to my first responders. That way they know in the 2.5 to 4 minute response time to get to your location, they know exactly what they're walking into. That helps us tremendously. And lastly, I'll say this, that we know the school is starting in some areas, it starts Monday in other areas. Most of those kids are unvaccinated. The CDC guidance says, get your vaccine, all right? They're not shy about it, and they're also saying social distance and do all the right things that you talked about. We fully support that. I think if you look at the statistics, who's in the hospital, the vaccine works, all right? Whether you like the vaccine or not, you cannot deny the fact that the vaccine is working. We already know from a number of other agencies throughout the whole medical chain that a booster is probably coming because they figured out that your immunity kind of wanes over time. But we still have the problem right in front of us. The unvaccinated, mainly our children, and they're all going to mingle together. And guess what? They're going to take that home. And they're going to spread it to all the brothers and sisters, the parents, and they're going to go to HEB and Walmart and Lowe's and do whatever. And we're going to pretty soon on down 20 firefighters, 15 police officers. It's that quick. So we need to do the right thing. And the right thing is, if you are vaccinated, you got to still remember that you have a responsibility to adhere to the CDC guidance, which says to wear the mask, social distance, wash your hands. If you're unvaccinated, you're highly, highly encouraged to get the shot. And then if you're not going to get the shot, okay, if you're just one of those who says, okay, that's fine, you can have that opinion. You still have a responsibility to your fellow citizens to stay away from them. And if you get sick, by God, stay home and don't spread it somewhere else. That's really what we have to figure out now is what are we going to do starting tonight to protect these children? And we have thousands of them in all of our school districts. So the city's here to help. The mayor wanted me to close with Judge Madrid. He knows that we work very closely with him. We're kind of lockstep in whether the mayor has the idea or the judge has the idea on what kind of emergency order we're going to declare or whatever. We go same way. The county and the city, we work side by side. And we will continue to support you, Judge. And if the mayor has an idea, you know he's going to call him. So just wanted to leave you with that. Thank you all for your participation. If you need to find me, I'm pretty easy. The City of Kingsville website, there's a link to the city manager right on the front page. So happy to answer any of your questions, and I'll be hanging around after the meeting. So thank you.
You couldn't have said it better. The city and the county have an amazing relationship, and we've been partners since day one. I can't thank the city staff, the and all of them, and all the city commissioners. They've been our best friends since day one on this. So can't thank you guys enough. Round of applause again for the city staff. In school. So one last message. When all the naval hospitals in the United States and around the world, they have 3 flags that hang in front of them, and that's actually like a Navy advancement question. Whenever you go for advancement exam, you always see that wonderful question: what do the 3 flags stand for? It's in front of a naval hospital, and it's called standing by, ready to assist. The county is always standing by, ready to assist you in anything you need. We're proactive, we're not reactive. We're always working, believe me. When you don't see us, and social media, it plays their games, it does all that good stuff. When you don't see us, never for a second think we're not working, because we are always working behind the scenes. It hasn't stopped for a 1.5 years. We're not going to stop until we eradicate this. And again, the only way we're going to eradicate it, I'll say one more time, is if we all work together, and we're going to be together, I promise you. The county judge is a huge yes that our new JK Northwood once went this all over. So God bless you. School's got to pass. All right.
Thank you, President Grant. My name is Dr. Susie Rosebeth, and I'm the superintendent here at Kingsville ISD. I just wanted to make sure that, let you know that I welcome all of you to Regeneron. We are all part of one county, and I always say teamwork works. Our judge and all of our city leaders have been so supportive. They've been our champions since COVID began. Our boards have been so supportive of us as well. Something beautiful that has come out of this is that all the superintendents in our county, we have come very close, like a sister name, because we're all in this battle together to protect our children. You know, it's one thing that you're fighting to protect your students and your staff, but when it hits home, it's pretty, I mean, you can feel it. A couple of hours ago, we lost someone that we loved truly, a beautiful, beautiful lady to COVID. And I'm gonna have to leave right after this, so I can go leave my family. But I remember her always telling me, you keep going into education and protect the partners. We connect and relay information to our boards of trustees that you see here this evening and our school communities. We maintain healthy rivalries while balancing camaraderie and championing each other's successes. Because when students are successful, the community is successful. We stand united this evening in our call to duty and service to children and families to combat this devastating virus. And I speak for all of us when I say that we are proud to be part of this group of school leaders working together in service of Clayburgh County. I'm going to turn it over now to my friend and colleague, Dr. Veronica Alfano, who's the superintendent of San Gertrudis ISD, and she's going to talk about some information about TA and guidance.
I'm Veronica Alfano, I'm San Gertrudis ISD, and on behalf of San Gertrudis, I need to take a moment and thank Judge Mudley and Rudy Mudley, Rick Mudley, who just left. They were so vital in the decisions that we made in returning to school, in the vaccine distribution with the hospital, with the county, PPE supplies. Every step of the way, we felt supported by our county, our city, and our hospital. And I think that's what's gotten us where we are today. And we truly want to do everything we can to protect our community. With that, as educators, we answer to TEA. And we're kind of building the plane as we're flying it, and I tell that to our staff day and day again. The public health guidance was updated again today. I know individuals were upset at the very beginning because the first guidance said that we could not notify, we did not have to notify of close contact. As of today, we are required to notify close contact and send out notices.